Hey everybody, how's it going? I'm here in Ottawa today. Well, actually, I got good news for you. I am now a resident of Gatineau, Quebec, which is right beside Ottawa. I moved here, I found an apartment, I'm here for a little while, and I'm just trying to find work and get into a good job, which I think I'll probably get into federal politics one day. And this is something I'm pursuant of, so it's why I'm in the area. Hey, have you ever wondered why when you go to get a surgery, your wait time is enormously long? You break something bad, you have to have orthopedic surgery, and you're put on a wait list and it takes forever to get the care, and you're sitting there stressed, you're sore, you're wondering how you're ever going to recover or make it through, how your recovery is going to go. Well, don't worry. I made a policy brief on this, and I presented it to the Committee of Health in Parliament to try to make this implementation ideal a little more smoothly, to deal with surgical backlogs in OR, to deal with orthopedic backlogs so that people and patients can make sure that surgical rooms are operating full time. We have more surgeons actually doing the work for us. Healthcare management can get on board and understand the principles of treating these backlogs through public health, through proper funding that's already available in there, more or less. And dealing with it rather than the private sector dealing with it, which could become messy and long-term prosperous or long-term growth opportunity in keeping our public health system intact as it may change throughout life. So don't worry, I got you guys covered. This is what I'm trying to present and do. It's a little bit different than some of the other things that are going on in the health committee now. We have marketing and advertising for children's dietary needs or adverse marketing. We have implants or things that go into the human body of consideration of what's legal or not. There's vision care for the elderly, which is important, but of a national plan which may or may not work right now. This one makes sense. This one's about healthcare reform that needs to happen, about proper funding, about those waiting for transformative life-occurring events of something being broken, which could lead to like a hip replacement not being done in 48 hours could lead to someone dying, or a distal radius like myself in my wrist, where I had to wait multiple weeks before a surgery and the recovery time's not ample and you lose a little bit of mobility. People don't want to worry about these things. People want to know that if they go to physio, that's fine. They want to know that if they're treated for their injury or whatever it may be, for an orthopedic surgery, that it's being done in an effective time by a good practitioner, a good healthcare professional. They don't want bounce surgeries when they're preparing physically and going through all this agonizing stress. Anyway, I made a brief for you guys and I care about it, and I'm trying to make sure that this gets implemented and considered. So don't worry, I'm looking out for you. I look out for the things in my life. And now I live here in Ottawa. I made a move from Montreal tentatively. But I can make all this work. I always make everything work. And this is probably one of the best briefs and policies put forth in the Health Committee in the past 6 or 7 years that is actually looking at the bigger issue of why, Canadian public health may be in a little bit of a state that it's in now. Anyway, enjoy your day. Beautiful view. Bye.